Freezing snow on Sunday and a super cold vaccine on Monday, one arriving unannounced, the other much anticipated. And within hours, Pfizer's COVID-19 vaccine was being administered to frontline medical workers. With an efficacy rate of more than 94%, this is the game changer we've all been waiting for. But it will take time. So let's spend some time with Rory Taylor to learn more about the vaccine, how it works, and who is first in line.
I'm not just doing it for me, I'm doing it for you and your family too. So it takes one person to stand up.
Monday at Integris Baptist Hospital, Hannah White made state history when she became the first Oklahoman to receive the Pfizer vaccine against COVID-19.
Try to keep back the tears right now because no one has to die alone. If we can just do it together, then this stops with a simple thing like a vaccination that didn't even hurt, by the way.
After the FDA approved the vaccine last Friday, Operation Warp Speed was quick to drop off Oklahoma's first delivery.
This initial delivery includes 33,000 doses of the Pfizer vaccine. 7,800 of those doses arrived here at Integris, some of which will be redistributed to other healthcare facilities and regions across the state.
9,750 of those doses arrived the same day in Tulsa, all to be immediately taken from freezer trucks and put into hyper-cold storage.
The Pfizer vaccine presents unique challenges in distribution and storage as it needs to be kept at ultra-cold temperatures. Our team has worked diligently to ensure the super cold vaccine can be shipped across the state, including rural areas. In addition to thorough planning, we have had partners donate ample storage equipment that allows us to facilitate statewide distribution. Through these generous donations, areas that may not have had much available storage space for the vaccine can now easily store the ultra-cold Pfizer vaccine in their facilities.
The vaccine needs to be stored at around -94 degrees Fahrenheit because of the new technology of messenger RNA vaccines. The vaccine essentially has blueprints for your cells instead of dead virus to practice fighting. But those blueprints, that RNA, can be easily destroyed by any number of enzymes unless everything in the vial is frozen to a standstill at temperatures only some of the state's facilities are built for.
Given the difficulties of vaccine storage and the differences between the vaccines, we're going to have to be as flexible as possible as we roll out the vaccine throughout our distribution plan.
Flexibility reflected on Thursday when K-12 teachers were moved up to Phase 2 with at-risk populations, following Phase 1 medical staff and long-term care residents.
I think up to 93–94% have been in person, but some of the schools have not been in person since last March. It's almost a full year. And so that's the vision I'm casting. But ultimately, it's a local school board decision. So I'm saying let's give every kid an in-person option.
This rollout plan is roughly reflected by the plans of most Oklahoman tribal governments. Dr. Billy Beats, Chief Medical Officer for the Muskogee Creek Nation, shared in an interview with NPR that they have a tiered system which basically covers healthcare providers as well as inpatients, and then the general citizenry and those that are considered quote-unquote essential workers, such as light horse and child services. But many of those tribal healthcare facilities lack the needed hyper-cold storage, so while units are on back order, the vaccine is being kept on dry ice.
Back earlier this year, they kind of informed us that we need to be ready, that there's a potential for the need for dry ice for one of the vaccines.
Steve Stobaugh is one of the owners of Tulsa Gassing Gear, which deals in welding supplies.
So the problem with dry ice is that you can't produce it and store it to have it available for long term. You know, it's stored at -110 degrees, so we pretty much have to produce it for orders. We've known about the possibility from the state for about a month that they were going to need to have dry ice. When the exact date was, we didn't know.
The dry ice comes from pressurized and refrigerated gases and comes out in a snow-like fluff, which is compressed into blocks or pellets.
We ship them in these blue containers. Each one of these blue containers can hold 600 pounds. We make about 5,000 pounds of dry ice per day.
5,000 pounds of cold, shipping to numerous hospitals around the state to help fight COVID.
It gives us a lot of pride to be a part of this effort. Never did we dream that we'd be a part of this effort back in March when this started to happen.
But public officials warn that while vaccines are a big step, distribution will take time, and the effort to restrict community spread is far from over.
I want to thank all Oklahomans who are continuing to take precautions to prevent the spread of COVID-19. It's critical that we all keep up our fight. It's going to take several months to get this vaccine out to everyone, but there is light at the end of the tunnel, so we've got to keep pushing hard.
Everyone should continue to wear a mask, wash your hands, watch your distance while you wait for the vaccine.
Just because you saw a nurse receive the vaccine on television does not mean that you have magically received the vaccine. Don't be the last soldier to die in the war where the peace treaty has already been signed.
Rory Taylor, the Oklahoma News Report.
Rory, thank you. And more good news on Thursday with an FDA advisory board recommending emergency authorization for the Moderna vaccine. Proven just as effective as the Pfizer vaccine in clinical trials, it is expected to begin arriving in Oklahoma next week. Tulsa International Airport is about to launch the first airport in the country to offer COVID-19 testing. The testing will be available inside the B terminal and includes rapid tests as well as a complete respiratory panel test, including for the flu and RSV. The COVID tests are available to travelers at a charge, but they can't submit for reimbursement to their health insurance companies. The testing begins on January 4th. More than 22,000 Oklahomans contracted COVID in the last 7 days. That's a rolling average of 3,200 per day. There are a record 1,733 people hospitalized with the virus as of Friday. 460 of them are in ICU beds. And 154 people have died from COVID-19 this week, bringing the death toll to 2,161. AARP is now offering an online system to track how well nursing homes are handling the COVID pandemic. The dashboard tracks staff shortages, levels of personal protective equipment, as well as how many staff members have tested positive for COVID and how many residents have died due to the virus. AARP State Director Sean Voskuil says this is a good tool for families and policymakers during the pandemic.
It's a great interactive tool that we can compare our data and analytics to other states and kind of see where we rank. But we think it's an excellent tool for our policymakers and our agency leaders to understand how Oklahoma ranks and how we can do better.
That dashboard can be found at aarp.org/nursinghome dashboard.